Cordillera region in the northern part of the Philippines is the ancestral homeland of various indigenous peoples comprising the majority of 1.7 million regional population. Half of the population are located in the urban Baguio City and the province of Benguet, where two large mining companies are operating. Being the mountainous and cold climate, the region supplies 70% of temperate vegetables in the country, as well as being the major producer of cut flowers. Thus, with the lockdown quickly imposed on the context of the COVID-19 pandemic, the most affected are the informal workers in the urban city, farmers of cut flowers, and the vegetable industry. Because indigenous farmers in the interior communities are producing for their own communities and own consumption, the dislocation is on the disruption of their otherwise seasonal work in the urban and provincial centers.
I am Carmen Bulinto, a health worker working here in the Cordillera region. And I also teach in the university with nursing students. And I also volunteer with non-government organizations in health. Now, on the second to the last day of our clinical duty in the community, the government officials declared that there should be a closure of businesses, of business establishments, of the schools. In relation to the vulnerable communities, I would like to believe that these vulnerable communities are those in the marginalized sectors, in the far-flung areas. They will be at a more double risks in case the infection will enter the communities. They had been so isolated geographically, and that can be a positive protection for them. But once people who are coming from the outside, like for example from the cities or from overseas, and these are people coming from positive COVID communities, then they will be the most vulnerable. Why? Again, because the healthcare system that is supposed to take care of them is not ready, and it's very inadequate. The services are inadequate, the hospitals, the facilities, the health manpower, and the medicines and others, most especially for the protective personal equipment, these are very inadequate to give them support. As a healthcare professional, I think one of the most important challenge is really to support these indigenous communities, those who are in the marginalized areas, because if no one will do that to them, they will be at so much risk. We have been demanding for mass testing, but it has never been given to the people, especially for the health workers.
Nung last March, yun na, nagkakanda-kanda hirap na yung mga taxi, jeepney, UB Express. And so, with the bus companies na pinahinto nung pandemic na to, malaki yung epekto sa kabuhayan namin na mga driver saka maliliit na operator.
Katawan mo ti dadu mga alternative ta lockdown nga ron siyang agutang siyang kalpasan da iti puwi da ka kabutbutong mo nga utang ati sangsangon tumanen sumaron.
Nagrugi ti lockdown ket jay nagrugi met nga awan tinaila ko nga pulos jay nulami ket naibasura amin titansyak lang ban nga 200,000.
Ti epekto na dahito ang pandemya ket talaga nga krisis han kami nga makalako awan ti panggatang ti kanon ni adaman ti ito ti gobyerno talaga nga kurang.
The Cordillera People's Alliance is an alliance of 307 people's organizations and sectoral organizations in the different provinces of the Cordillera region in northern Philippines. Throughout these decades as well, we have been partnering with the Center for Development Programs in the Cordillera, especially in providing socio-economic projects or support to far-flung indigenous communities in the region. Throughout these decades of our existence, as an organization, the Cordillera People's Alliance has been experiencing attacks for speaking out against corporate projects such as large-scale mining and large dams, for criticizing policies of the government that impact negatively on Cordillera indigenous peoples, as well as indigenous peoples in other parts of the country. So, during the time of COVID, the attacks against us have intensified, especially through social media, particularly Facebook. So since the lockdown in March until now, there are numerous posts at Facebook and other social media platforms that tag us as terrorists, as communists, as recruiters of the New People's Army. They also vilify us, portraying us as evils or demons. Last year, the government has implemented the Executive Order 70 of President Duterte, that is the whole-of-nation approach to end insurgency in the country. But the problem with this executive order is that it targets legitimate people's organizations, and that includes the Cordillera People's Alliance. So we fear for our lives. But instead of the government addressing these attacks or looking into these attacks so that it will stop, it has passed the anti-terrorism law. It targets all the more political dissenters, activists, human rights defenders, environmental defenders. So this will mean shrinking space of civil society here in the country. It will mean silencing the people.
Sudah sa diri pa ng baliw ti kagimungan.
For us indigenous peoples, one of our utmost concerns is that with this terror law, our very own struggles against large-scale mining and destructive dams may be interpreted as acts of terrorism, because terrorism is very vague as defined in this law. It could mean violations of our basic human rights. They could arrest us without warrants, detain us without charges. With this law, we want that this law will be repealed. We want that this law will be jumped.
The Center for Development Programs in the Cordillera is an NGO advocating for the right to food, right to livelihood, right to health in human rights and indigenous people's rights perspective.